I think that vein ablation is a good procedure where you can go right back to work for the most part. Certainly anyone who's standing on their feet for their occupation is at risk and would need a venous ablation, such as people who work as teachers or in a hair salon, or who work in a boutique, or who work as a chef or in construction, or surgeons who stand for a long period of time. In a venous ablation, the patient basically lies on the table. I ultrasound, I put a little bit of numbing medicine in, and I can access the vein by ultrasound and place a catheter inside that vein under ultrasound. Once the catheter's in place, I make sure that it takes up the amount of vein that I want shut, and then I numb all around the vein, and then I basically heat it shut. Venous ablation uses catheters, and a lot of the other modalities also use catheters. For example, when we do vein ablation, the catheter has a heating element, and it's put inside the vein, and the vein is heated shut with the catheter. Other modalities use pharmacomechanical ablation, where we use a catheter that disrupts the inner lining of the vein and gives medicine at the same time. Or like cyanoacrylate glue, which is delivered through a catheter to shut the vein. And then there's also a type of sclerosant that's given to also shut the vein, which is delivered through a catheter as well. It's a very safe procedure, and it's a very rare instance that you would ever get a complication. In fact, what we do is we keep the catheter 2 centimeters away from the deep system, so we avoid any deep vein thrombus. In a very rare instance, everyone should check that there's a deep clot, but it's the reason that we check 3 to 5 days later.